Thank you for taking the Zoom call from me.
Oh, hey, Max. So good to see you.
I put on lipstick just for you,
Ah,
just for this call. So, as you know, I am like the explainer to my friends and family and healthcare stuff. And I realized that I don't know anything about Medicare. And so I'm calling you because you're my expert, because I have questions.
perfect.
So my first dumb question is, in a nutshell, what is Medicare?
Well, Medicare is the federal healthcare system that everybody pays into over the course of their lives through Social Security. So it's a huge pool of money. And then the people who can use Medicare to pay for their health care are people over 65, people on permanent disability, and then there's some special circumstances, like on a personal level. My son had a rare disease when he was 5 and eventually needed a kidney transplant, and Medicare did pay for that transplant.
Wow.
So Medicare for All would extend these benefits to everyone, regardless of their age or their pre-existing conditions.
Okay, so I don't know if there's an easy way to explain this, but why would people want Medicare for all as opposed to getting insurance like they do right now?
Well, all other developed nations have some kind of a government-run healthcare system, but in America, most of our insurance healthcare is based on employment through their jobs. COVID-19 has shown us one huge glaring problem with that, where healthcare based on their employment is dangerous, because when people lose their jobs, they lose their healthcare, and during a pandemic. So a lot of the essential workers that we relied on to keep everything running were actually classified as self-employed or gig workers. And they don't have that job-related health care. They would have to self-insure or go without. So they had to put their lives in danger without insurance at all. Medicare for All would have given everyone health care coverage.
Okay, so the main reason why I'm calling, as I read about this thing called, it's a state assembly bill, AB 1400, that's being considered right now, and it's for something called CalCare. Is CalCare the same as Medicare for All?
CalCare is a bill that is a universal health care for all Californians. So Medicare is funded by the federal government. CalCare would be like Medicare, but it would be funded by the state of California and only for California residents. So California has the 5th largest economy in the world, so we can operate as our own country. Instead of waiting for the federal government to create a healthcare system for the entire country, we can cut the red tape and create a better healthcare system for Californians.
Okay, so you talked about cutting red tape. Can you give a specific example of like what is a benefit of having a California-only healthcare system like CalCare?
California has been able to set higher standards than the national standards in several things, like the safety standard for cars, because we have a huge market share. If we had one big healthcare system, California would have the bargaining power to actually demand affordable prescription drug prices. Right now, it is currently only the VA that is able to have negotiated drug prices from the federal government. No other healthcare group in the United States is allowed to demand better pricing from pharmaceutical companies. This is why Americans pay 8 times more than other countries for insulin, and people that have ongoing drug usage sometimes have to choose between food and taking their prescription. Other countries don't allow the pharmaceutical companies to jack up the cost of medications.
Yeah, I have a asthma inhaler that I need, and it finally went generic after years and years, and then they redesigned the nozzle, and now it's $65 again. It's the same.
There you go.
It just redesigned the plastic mouthpiece. It's outrageous.
Absolutely.
And it costs $4 in Canada.
Absolutely.
So that's a big deal for me. But my mom already has Medicare, and she loves Medicare.
Mm-hmm.
So why would she want to switch from Medicare to CalCare?
Oh, you know what? As CalCare is described in AB 1400, it would have additional benefits that are not covered by Medicare. And actually, those additional benefits are not covered by most people's private insurance at all. So CalCare would cover, have dental coverage, eyeglasses, hearing aids, which are incredibly expensive, mental health care, and one thing really important to seniors is CalCare would provide for long-term care, and that's not covered by Medicare at this point. CalCare is Medicare for all, but it has extra benefits.
All right. I mean, that's awesome. So the next big question that I get that I can't answer is, would I still be able to see my doctor?
Really important question. And the answer is absolutely. You would be able to see your doctor, or if you hate the doctor that you have under your current health plan system, you can go to a different one, because you will have every Californian doctor, hospital will be accepting CalCare. So you can go and get the actual care that you need from whoever is available.
Okay. So the next question that I get as pushback, when I try and explain why, I've had better healthcare that was cheaper and just as good in other countries, is what happens to all the people who work for insurance companies? Will they just lose their jobs?
Well, the answer is yes, because insurance companies will not be operating in California because health insurance will be provided by the state of California. But as that program develops in California, there will be a need for people to actually run that program. There's actually language specifically in the bill AB 1400 that provides funding and training for people who would lose their job because of CalCare.
Okay. I mean, that's a good explanation, because it also states the obvious that wasn't really obvious to me, which is like a lot of these people will just go and start working for the state version of CalCare. They'll do their same job just for a different company.
Absolutely.
Which is the state of California. Okay, I got that. So next big question is like, how does this get paid for?
That's the big question for sure. And the main way that CalCare would get funded is that California would ask the federal government to divert the money that is funding different federal programs like Medicare back to California so that we could use that money to fund CalCare. So Californians would control the funding for our health care. Obviously, it's more complicated than that. But Bernie Sanders, Elizabeth Warren have referenced many different studies on how to fund Medicare for all. And what is important to know is that all of those studies show that Medicare for all would give better access to health care for all Americans and save the government money. And, I want to emphasize, it doesn't matter what you think about Bernie's politics, because the math does not care about how you vote. The Koch brothers, who are huge billionaire right-wing funders, they had a comparison cost study done, and their study showed that Medicare for All would save the government money. So it would also be cheaper for businesses, because it's incredibly expensive for them to provide healthcare insurance for their employees. And it would definitely save Californians money, because we would no longer have to pay premiums and co-pays. So, and like I said before, we would be able to negotiate with the pharmaceutical companies for lower drug pricing. So it would save money all across the board.
Okay, so for somebody like me who is already, a fan of the concept of Medicare for All, or CalCare in this case, will AB 1400 be on the ballot in the next election cycle? Will it, how do I get out the vote, I guess, is my question on this.
Oh, yeah. You know what? It is not something that's going to be on a ballot for us to vote on. AB 1400 is a bill that our legislator is making the decision on. So if you want a Medicare for All CalCare system in California, you need to call your legislators and let them specifically know that you want them to support AB 1400 and or CalCare, because they need to know from their constituents that that is what people want.
Okay, so just to be super clear, like when I email or call or write a postcard to my rep, I have to ask specifically for them to vote yes on AB 1400 or yes on CalCare, as opposed
Absolutely.
to saying, please support Medicare for All.
No, go ahead and you should be specific. The polls have shown overwhelmingly people want Medicare for All, but what we want is for our California legislators to put through AB 1400 and or what's called CalCare now. We want that to be voted on and passed through now, so that we can provide Californians with health care.
Okay, great. So when I contact them, I'll say AB 1400.
Oh, thank you so much, Max.
Well, thank you for answering all my questions. I know that was kind of a lot, but it'll help a lot of people.
It.
So
yeah, thank you, ma'am.
Well, I will talk to you soon.
Okay, bye-bye.
Bye.